Let's jump right into this explainer and map out your potential career trajectory across the incredibly diverse world of medical billing and coding. If you're just stepping into this field or maybe looking to pivot from your current career, you might be picturing yourself quietly sitting at a desk in a small doctor's office, right? But actually, the reality is way bigger than that. The healthcare revenue cycle is this massive, multi-billion-dollar engine, and you are literally the crucial component keeping the whole thing running. So today, we're taking a micro to macro journey. We'll start with clinics and dual roles, scale all the way up to hospitals, explore billing companies as training grounds, look at insurance payers, and finally, help you choose your ideal career path. Section 1. Clinics, dual roles. Let's start small. Well, not all medical practices are created equal. Picture a fast-paced, multi-physician clinic. You've got dedicated admin teams, an office manager, and a super high patient volume. Basically, you're part of a well-oiled machine. But now, contrast that with a solo practice. The pace there is definitely slower, and office politics, virtually non-existent. But because the staff is tiny, you're the coder, you're the biller, and, maybe even the receptionist. The catch here is that getting time off can actually be pretty tough, mostly because your schedule is directly changed to the doctor's schedule. And this brilliantly illustrates why smaller firms rely on one single individual to just wear both hats. Combining roles absolutely saves operational costs, but for you, it means becoming the undisputed anchor of that practice's revenue cycle. You're going to need deep expertise in both arenas, coding the complex procedures and chasing down the payments, just to keep the business afloat. Section 2, Hospitals, Scale and Specialization. Let's scale up. In a hospital setting, the financial framework completely flips. Enter DRGs, or diagnosis-related groups. Instead of just billing for individual Band-Aids or quick outpatient blood tests, hospital reimbursement is fundamentally tied to the severity of the patient's illness. So think of it this way. The sicker the patient, the higher the risk, and the higher the facility's compensation. This demands absolute surgical precision in your coding because the hospital's revenue directly relies on exactly how accurately you capture that patient's severity. And unlike the dual roles of a solo clinic we just talked about, hospitals are massive, highly departmentalized operations. Here, you definitely aren't wearing both hats. You are specializing. A hospital coder focuses strictly on facility coding for the inpatient environment. That means generating codes that cover massive facility costs, literally everything from the room itself to the medications, the anesthesiology, and even implanted medical devices. Most of the time, your coding will be totally unique to a single specialty or department. And once you assign those codes, a completely separate, centralized billing division handles the actual claim submission. It's a huge team effort. Moving on to Section 3, Billing Companies' Training Grounds. Because of the sheer volume of patients and, let's be honest, the overwhelming complexity of modern insurance, there's a massive trend of doctors outsourcing their accounts receivable entirely. Practice management and billing companies have become incredibly attractive environments for medical professionals. In this kind of setting, you work strictly in one capacity, either as a coder or a biller, handling administrative duties for multiple different clients, all from one central office. Honestly, if you're newly certified, third-party billing firms are arguably the ideal career bootcamp. Why? Well, first off, software exposure. You're juggling different systems for different providers, which makes your resume practically bulletproof. Second, built-in mentorship. You aren't just working in a silo. You can literally turn your chair around to bounce tricky codes off seasoned professionals right there in the room with you. And finally, specialization. You can actually join sub-teams focused on niche industries, like radiology or anesthesia, allowing you to develop true, highly sought-after authority in a specific discipline. It's a real game changer. Section 4. Insurance Payers, Processing Claims. Let's look at the other side of the desk. Have you ever actually wondered who is evaluating the claims you meticulously code and submit? Well, the insurance companies themselves need professionals who deeply understand medical coding and billing to process these claims from the inside. Working for an insurance payer means you act as a claims processor. You're essentially a healthcare detective. Your daily tasks are highly analytical. You evaluate claim validity by really digging into submissions to ensure they follow strict plan guidelines. You'll cross-reference payer contracts, matching national provider identifiers and tax IDs to ensure pricing aligns perfectly. And crucially, you handle disputes. When a doctor's office challenges a denial, you are the expert. You rely on a deep knowledge of medical terminology, CPT modifiers, and ICD-10 codes to navigate that conflict and explain the policy correctly. It's a very critical role.
Section 5. Choosing your career path.
So, this explainer has shown that this field is anything but one-dimensional. As we summarize your options, remember this. If you want a generalist role where you control the entire revenue cycle, a small clinic might be just for you. If you crave high specialization and dealing with complex facility costs and DRGs, aim for a hospital. If you want mentorship, lateral growth, and serious software variety, a billing company is for sure your best bet. And if you're highly analytical and want to be on the evaluation side, verifying contracts, definitely look toward the insurance payers. Oh, and a great way for beginners to simply get their foot in the door is by taking a role verifying patient benefits, which really exposes you to all these elements at once. I want to leave you with this question to help you map out your future in this dynamic industry. Which environment best fits your work style and career goals? Because the truly amazing thing about medical billing and coding is that whether you want a quiet office, a high-stakes hospital department, or a corporate desk at an insurance carrier, there really is a perfect fit for every single personality type.
Please like, share, and subscribe to Decode Healthcare with Harshal.